Thank you very much for taking the time from your very busy schedule to talk with Africa.com. Our audience is very interested in what you have to say. I think that, as you know, we have a very strong audience in the economics and business realm, and so we'd like to focus on those elements of the report. And I'll just give you a quick overview of what we hope to accomplish in these 20 minutes that we get you. We think that the title, "We Can't Stop It Almost," is a brilliant headline, and so we'll follow that throughout the course of this discussion. And the first question we're going to ask you about is why you focus on children as opposed to adults. The second question and area we'd like to pursue is around finance. I had a privilege of participating in your roundtable with Gates experts last week. We raised that question around finance and wondering if African governments and other parties are coming in to fill the gap that you have helped to raise awareness around with the withdrawal of funding from the U.S. government and other governments. And we want to understand how you see that finance gap coming together. The third will be around primary healthcare systems, and we'd love to hear you talk about the return on investment. In your reports, you discuss how $100 a year per person prevents 90% of childhood deaths. We'd like to just delve a little bit more into that and make sure that that's highlighted. And then we want to talk about innovation, in particular around AI, a little bit on African leadership in solving this problem. And lastly, I want to talk to you a little bit about optimism and why the focus on optimism, if this is a management principle that helps to motivate your stakeholders. So that's what we want to do. It's a lot in 20 minutes, so I'm going to jump right in and let you start by talking about why children, why the focus on children.
Yes. Well, children at many levels are the future. They are the human capital of tomorrow. They're also human beings. And it's also just a core value of the foundation. Our belief is a foundation that every person deserves the chance to a healthy and productive life. And the most important starting point to having a healthy and productive life is to survive. So preventable child mortality, is for us a key indicator of how a society, a global society, a national society, thinks about its own people. And the news over the first 25 years of this century has been good. The world has made more progress than ever before in human history, and that includes across the continent of Africa. We've seen a halving of preventable child mortality from over 10 million deaths a year to well under 5 million deaths a year last year, 4.6 million. But then tragically, as the report highlights, this year is almost certain to see the first increase in preventable child mortality this century. 200,000 additional lives. Instead of the steady decrease that we've seen, more kids are going to die. And that is completely preventable. The biggest cause of that is the cut in aid coming from large donors across Europe, the United States, and others. But it also highlights just a broader challenge that many governments have in terms of investing in healthcare and in innovation that helps benefit the poorest and most vulnerable. And so we want to use the report to highlight that challenge, to call to action to address it, but also to very concretely cite a number of innovations that we believe can help accelerate progress over the next 20 years so that we can at least halve preventable child mortality again by 2045.
So I just want to make sure I underscore one of the things that you've mentioned, that the reason for this increase in child mortality is largely because of finance. Is that right?
That's correct.
Okay, so let's move into finance. How do you see that gap being filled? I mean, we know that Bill Gates made the very big announcement that most of his $200 billion is going to be allocated towards public health in Africa, which is laudable. But we also know that that is not enough to fill that gap. And there have been several efforts announced in the course of 2025, including the Accra Reset and others, to inspire Africa to fill that gap. How do you see those things working? Do you think that that gap, there's identifiable sources of financing that are stepping up to fill that gap?
Yes. Well, in the short term, meaning this year, there's no combination of philanthropic or national government resources that can fill the gap. We're talking about cuts in the tens of billions of dollars that have come from high-income countries And that scale of resourcing is just simply, the challenges that African governments face because of debt issues, of domestic economic growth issues, that in the short term, that gap is creating exactly these consequences, these preventable child deaths, and also, some adult deaths in areas like HIV and tuberculosis. And that is a tragedy. But the path to long-term solutions, the vision of that 20-year vision of at least halving preventable child mortality again, is going to come under African leadership by African governments, African philanthropists, the African private sector coming in over time to step in and provide the resources. But I emphasize that is over time, that we don't challenge the notion that aid shouldn't ever be forever. It's supposed to be a temporary support to help countries build the infrastructure and institutions and the human capacity to address the problems of their own citizens themselves. That is exactly the Gates Foundation's commitment. It's why we intend to spend ourselves out of business by 2045. We will commit $200 billion and then we will go away, because we hope and believe for most of the areas we work on, the countries we work with and the partners we work with will be able to take on that work themselves. And so how do you do that is the critical question. And that means over time, you need to increase domestic resource mobilization. You need to increase the resources, the proportion of resources that are put into basic healthcare investments, which has not always been the case historically in many parts of Africa. There has probably been an over-reliance on donor support, which the current cuts have really thrown into a dramatic and harsh perspective, and the costs are being measured in human lives. And so what we want is a combination. We want the high-income countries to make sure they aren't cutting the most important and high-impact investments. These are investments like the Global Fund to fight AIDS, TB, and malaria, which President Ramaphosa just co-hosted the replenishment of last week in Johannesburg 10 days ago. These are initiatives like the Gavi Vaccine Alliance, which helps provide vaccinations around the world for the poorest and most vulnerable children, and saves many millions of lives as a result. And so those shouldn't be cut, is our hope. That even with the overall cuts in resources, those investments should be preserved, although sadly we've seen that both Gavi and the Global Fund, which had replenishments this year, did not reach their full targets. There have been important contributions made. The Gates Foundation maintained its contribution in both of those efforts, but those cuts are challenging. And so we need a both and. We need traditional donors to step up and make sure that even if they are repositioning themselves over time, they shouldn't cut the highest impact investments that most benefit the poorest. And we need the governments of the low and middle income countries, including across the continent of Africa, to say these are commitments that we are going to step up and help provide with the support of philanthropies like ours and others. But over time, that should be taken on as the primary responsibility of African governments to their own citizens.
Based on your deep understanding of the economics of how this works, do those tens of billions of dollars that you're speaking about as having been cut and missing in the current budget, do the African governments have those tens of billion dollars? Is that realistic? Does the money
Currently,
exist?
they do not. They do not have that in a bit, and that's why I say, unfortunately, there's no way the short-term gap can be filled right now. And that's why our report is so strong at saying, actually, it is morally and politically critical for wealthy governments like the US and the UK and Germany and France to make sure that what are effectively tiny proportions of their budget are maintained while we're building the capacity or helping build the capacity of African governments to step into that gap. So they can do some things, and the governments from Nigeria to Kenya to Uganda to Rwanda to South Africa have been making additional payments this year to try and address some of the abruptness of the cuts, because we've seen tens of thousands of healthcare workers and others laid off as a result of the cuts. But those are small steps that have to be built on over years, and what we need is a plan over the next 5-10 years by which African governments take on increasing responsibility year by year, and donors and philanthropies like us take on decreasing responsibility, but do continue to provide some of the, call it the risk capital, that we know it's very difficult for, say, a government like South Africa's to invest in a high-risk tuberculosis vaccine, which is something that we're currently making major investments on across Africa, which South Africa is the largest site of what would be the first new tuberculosis vaccine in over a century, and we'll know by 2027 if that works. Now we're investing on the order of $700 million in that. That's a high-risk investment. If it works, it's going to have massive returns, and we will look to governments across Africa to help scale it up. If it doesn't work, we'll take the loss, and that's a risk we're prepared to take. But we need to have that combination. We need national governments across Africa saying these healthcare investments, and that's an investment in innovation, are things over the long term we want to do ourselves. But we can work in partnership with philanthropies and high-income governments in the meantime to build the infrastructure and the capacity to do that.
Your report provides a very compelling case for investing in primary healthcare systems for business people, and you articulate it in a way that's very easy to understand the return on investment. You speak about how this $100 per person per year results in a 90% reduction in childhood deaths. Can you talk a little bit more about that and just go a little bit deeper in helping people understand how that investment works?
Yeah, so look, all investments in health are good. We believe investing in health is a true public good. But often governments, we think, will overinvest in tertiary healthcare, the big fancy, big city hospitals, at the expense of primary healthcare, which is actually where you get the most bang for your buck, which is why we use that ratio that you talk about. For $100, we can prevent 90% of preventable childhood deaths. And that is because primary healthcare is the front line, whether it's getting an HIV, ARV treatment or preventive tool, whether it's getting antenatal or postnatal care at birth, whether it's getting those vaccinations I talked about, whether it's getting access to the malaria bed nets or getting treatment for a case of malaria. Primary healthcare is where that happens. And so investing in strong, robust primary healthcare, which is a trained healthcare worker, and with facilities that are well equipped and have the resources available for these basic interventions, is much, much, much more cost effective than any other form of investment. And that's often not understood by the business community and others, because that is the primary investment in the long-term healthcare of your workforce. The human capital that is going to be the productive workers of today and tomorrow get their basic care and treatment from primary healthcare facilities. And last but not least, the AI revolution has potential to accelerate the ability of primary healthcare to provide better results with fewer resources. We've been investing in AI research hubs in several African countries, including South Africa and Rwanda, Ghana, a couple of others, where some of this work is really starting to accelerate. And we hope in the next 3 to 5 years, we'll see significant progress there as well.
Well, it's a perfect segue. Can you talk a little bit more about that and give us an example of how AI is helping to, because I think part of what you have focused on in your report is that it's not only about replacing resources that have been lost with the same amount of money, but also making, doing more with the resources, the limited resources that exist. And
Absolutely.
AI certainly plays an important role in that by accelerating development and reducing costs for discoveries of medical advances. I know there are a couple of examples that you have. Would you share one of those AI examples with us, please?
Yeah, well, let me talk first more broadly, because I know you covered the recent Digital Public Infrastructure Summit in Cape Town. And we do think digital public infrastructure is the basic foundation to allow AI-enabled support services in multiple sectors: financial services, in education, in agriculture support, and also healthcare. So in healthcare, it works in a number of ways. One is you can have low-cost AI tools, which can be highly effective. So one that we've helped pioneer over the last couple of years is a handheld sensor, which with the AI algorithms can actually give you a hospital-grade ultrasound for a pregnant woman in a primary healthcare facility, which uses AI algorithms for low-resolution activity and can assess the risk of the pregnancy with the same accuracy as a hospital-based facility. that's a very tangible tool to be used in primary healthcare, which is transformative. And we hope a similar tool can be used over time for tuberculosis diagnosis, for breast cancer diagnosis. And so that would be transformative at one level. Second element is, what we call direct to consumer. If you can get much stronger local language-based services, which we're working on because it is critical there in the local language, you can consult, if your baby is presenting with a fever, you can have initial consultation that can help rule in or rule out, malaria or other causes, can help guide when you need to go to a healthcare practitioner or when you don't. All of these are very concrete initiatives which are already underway in many parts of Africa, but we really hope to be scaling. It's both for the individual patient, it's for the medical practitioner, and it's for the government services overall, using educational electronic medical records, and other related tools should be able to increase efficiency and impact across the entire health system at relatively low cost.
Very exciting to think about those possibilities. You've touched on this a little bit already, and that is around African leadership. We talked about that from a finance standpoint, but I know that there's also, you support local solutions to local problems and African leadership in addressing many of the issues that we're talking about. Can you just go a little bit deeper on that as well?
Absolutely. So, in the end, long-term success is only sustainable if it's driven by the countries and communities themselves. And that requires, investing in a generation of African leaders in the research and development space, in the healthcare space, in the political space, who are champions of this, African philanthropists and others. And so we see that as absolutely critical. So I use the example of the tuberculosis vaccine trials that we're currently looking, which are taking place in several African countries. And these are driven by African researchers that is going to be primarily of service to people on the African continent if they're successful. That we have, and actually the report has a great essay from the Ugandan malaria researcher who's doing pioneering work on malaria eradication tools. And really nobody understands the impact of malaria more directly than African leaders and researchers, because it's the African continent that has by far the greatest, or suffers the greatest impact of mortality from malaria. And so building that generation of malaria researchers from Burkina Faso to Uganda to Senegal, all areas where we're investing in, that's going to be the key to the long-term success around malaria eradication. And similarly, I mentioned the AI hubs. It's going to be AI hubs in African countries, modeling solutions that are going to be designed and customized for the African context, that is going to be the true long-term success of any of these investments and initiatives. So in all of this, it's a both and. We want to be investing in the tools and the products, but also in the people, because that's what's going to drive long-term success.
It's a great example of a term we've heard recently, FABA, for Africans by Africans. So glad to see that you're deeply committed to that. All right, tell us why optimism is an important business principle that is built into your work and globally. You have the Optimist Report. Optimism is a word that is thrown around quite a bit with respect to all of this. So just delve a little bit deeper into how you chose to make that an important piece of this strategy.
We believe that our optimism is a distinctive brand of optimism in that it's very grounded in facts and reality. When we speak and when we paint a picture of an optimistic future for the world and for the African continent over the next 20 years, we're not just making statements because we think it's important to have hope. We're saying this is grounded in reality. We've had 25 years of year-by-year progress. We have to make sure that this year's setbacks on child mortality are the anomaly, not the new rule. We've seen that progress happen in country after country across the African continent over 2 decades, reducing preventable child mortality, reducing HIV deaths, reducing TB deaths, reducing malaria. All of those have been halved. So we know it's possible because it's already been done. Now we need to go the next step. And we're saying not only do we have the tools that we've learned and developed over the last 2 decades, we have an incredibly exciting array of new tools coming on board, new vaccines, new treatments, new diagnostics, and the AI revolution that we just talked about. And if you combine these, you can actually map out graphically, here's how you can get to actually eradicating malaria. Here's how you can get to reducing HIV cases by well over 90%, or TB cases by well over 90%. This is true in other areas we work on beyond health. Here's how you can get transformation in educational outcomes for school children across the continent. Here's how you can get transformation in agricultural productivity across the continent. All of these are informed optimism, grounded in real, tangible tools and investments. And we think it's, optimism is the engine that drives the Gates Foundation. It hopefully drives progress across the world, not just the African, but especially in Africa, where there's often a tendency to look at some of the short-term problems and over-extrapolate. We're trying to look at a sort of 20 to 30-year perspective and say, well, we believe over the next 2 decades, we can get most of this work actually done. That's why we've committed the entirety of our resources to the Gates Foundation, the $200 billion you talked about earlier, to the next 2 decades, because this is the moment to tackle these problems and make sure that the next generation of Africans don't know what yesterday's problems are. They have to ask, what was it like to have HIV deaths? What was it like to have malaria deaths? We hope those will be for the history books rather than something that people have to experience in their daily lives.
Well, thank you very much, Mark, for your leadership on both the hard science as well as the softer elements that really drive the change, appreciating the FABA concept for Africans, by Africans, and the optimism. So we'll wrap here. Again, Africa.com, having the opportunity to speak with Mark Suzman, the CEO of the Gates Foundation. We thank you very much for sharing your time and expertise with us today, Mark.
Great. Thank you so much. Pleasure as always.